Bloodborne Pathogen Exposure Control Plan. The objectives of the Exposure Control Plan are to know the regulations that govern exposure control, understand the modes of transmission and other potentially infectious materials, ways to protect the worker from exposure to bloodborne pathogens and other potentially infectious material, including types of personal protective equipment, and how to handle a spill, release, or exposure. The Occupational Safety and Health Administration, or OSHA, developed the Bloodborne Pathogen Standard to protect workers from human bloodborne pathogen exposures. The Bloodborne Pathogen Standard covers all occupational exposures to blood and other potentially infectious materials and serves to provide methods to protect workers from exposure. The regulatory citation is 29 CFR 1910.1030. Bloodborne pathogens are pathogenic microorganisms that are present in human blood and can cause disease in humans. These pathogens include, but are not limited to, human immunodeficiency virus, or HIV. HIV weakens a person's immune system by destroying important cells that fight disease and infection. No effective cure exists for HIV, but with proper medical care, HIV can be controlled. Hepatitis C virus, HCV. Most people become infected with the hepatitis C virus by sharing needles or other equipment to inject drugs. There is no vaccine for hepatitis C. Hepatitis B virus, HBV. Hepatitis B is a liver infection caused by the hepatitis B virus. Hepatitis B is transmitted when blood, semen, or other bodily fluid from a person infected with the hepatitis B virus enters the body of someone who is not infected. Bloodborne pathogens can be transmitted through contact with infected human blood and other potentially infectious body fluids. The most common ways for bloodborne pathogen transmission are through sexual contact, sharing of needles, from mother to babies, at or before birth, contact with broken skin from parenteral, rashes, cuts, punctures, abrasions, acne, and sores, and contact with mucous membranes, eyes, nose, and mouth. Other potential infectious materials, or OPIM, include semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, amniotic fluid, saliva and dental procedures, and other body fluid contaminated with blood. Additional sources of OPIM: any unfixed cells, tissue, or organs other than skin from a human or primate, HIV or HBV containing culture medium or solutions, HIV containing cell or tissue cultures and organ cultures, and blood, organs, or other tissues from experimental animals infected with HIV or HBV. The following are not expected to be infectious unless visibly contaminated with blood: urine, sweat, feces, sputum, vomit, tears, and nasal secretions. If visibly contaminated with blood, it will be necessary to practice universal precautions. As part of OSHA's Bloodborne Pathogen Standard, Wake Forest offers the Hepatitis B vaccination series to any employee who is reasonably anticipated to have exposure to blood or other potentially infectious materials. The vaccine is provided at no cost to employees. The hepatitis B vaccination is a non-infectious vaccine prepared from recombinant yeast cultures rather than human blood or plasma. There is no risk of contamination from other bloodborne pathogens, nor is there any chance of developing HBV from the vaccine. To receive the vaccination, get supervisor approval and complete the HBV program form located on the EHS website. If you are offered the vaccination series and decline, you must complete the declination located on the Hep B vaccination program form. Control measures. One way to prevent exposure to bloodborne pathogens is through the practice of universal precautions. Universal precautions are an approach to infection control in which all human blood and certain human body fluids are treated as if known to be potentially infectious for HIV, HBV, or other bloodborne pathogens. Universal precautions involve the use of protective barriers such as gloves, gowns, aprons, masks, or protective eyewear, which can reduce the risk of exposure of the worker's skin or mucous membranes to potentially infectious materials. In addition, under universal precautions, it is recommended that all workers take precautions to prevent injuries caused by needles, scalpels, and other sharp instruments. Pregnant workers are not known to be at greater risk of contracting HIV infection than are workers who are not pregnant. However, if a worker develops HIV infection during pregnancy, the infant is at risk of infection. Because of this risk, pregnant healthcare workers should be especially familiar with and strictly adhere to precautions to minimize the risk of HIV transmission. The OSHA bloodborne pathogen standard requires universal precautions to be used when coming into contact with human blood, OPIM, and human body fluids that are visibly contaminated with blood. Keep in mind it is always a good practice to wear gloves when handling substances of human origin. Biological safety is the control of the exposure to prevent or minimize health effects to the employee. It is accomplished through engineering controls, administrative controls, personal protective equipment, and good work practices. Engineering controls. The equipment and devices that are used to minimize or eliminate employee exposure to bloodborne pathogens, such as biosafety cabinets, sharps with safer devices, hand washing facilities, and labeled leak-proof biohazardous bags and containers. Work practices. Routine use of barriers such as gloves and goggles when anticipating contact with blood or body fluids. Remembering to wash hands and other skin surface immediately after contact with blood or body fluids. Careful handling and disposing of sharp instruments during and after use. Hand washing is like a do-it-yourself vaccine. It involves 5 simple and effective steps: wet, lather, scrub, rinse, dry. You can take to reduce the spread of illness. Hand washing facilities must be readily available for employee use. Hands must be washed after removing gloves and after any exposure incident. Waterless hand sanitizer may be utilized if hand washing facilities are not available, but hands should be washed with soap and water as soon as feasible. When washing your hands, be sure to use warm water that is comfortable. Use liquid soap. Use friction by rubbing your hands together and rinse downward. And dry your hands thoroughly after washing. Administrative controls. Biohazard signs must be posted at the entrance of HIV and HBV research labs and labs doing other biohazard research. The sign must include special requirements to enter the area and the name and phone number of the lab director or responsible individual. Biohazard labels must be affixed to the container in a manner that prevents removal. Biohazard labels must be predominantly red or orange with a prominent biohazard symbol. Red bags or red containers can also be used in lieu of biohazard labels. Personal protective equipment. All employees should have access to PPE that is task appropriate and the correct size. The PPE may include but is not limited to gloves, gowns, lab coats, face shields, and goggles. Employee training on PPE should include the location, proper use, proper disposal, decontamination procedures for reusable equipment, and selection of proper PPE for the task. Eye protection is used when there is a potential for splashes, splatters of liquids. Examples are safety glasses, goggles, and face shields. Gloves are worn to protect hands and may be single-use or reusable. They include vinyl, latex, and nitrile. Protective clothing is worn to protect skin and clothing from hazards, such as lab coats or lab aprons. Respiratory protection is worn to prevent inhalation of airborne microorganisms, dusts, mists, and chemical fumes. Prior to wearing, employees must obtain medical clearance and training, and then fit test. This must occur annually. How to clean up simple spills. Be sure to protect yourself prior to cleanup of a bloodborne pathogen spill and use provided cleanup supplies. Any spill covering more than 4 foot by 4 foot area will be cleaned by an outside contractor. If there is a spill, unplanned release, or potential release of biohazardous material to the environment that does not fall under routine cleanup or is too large a release to be cleaned with normal procedures, University Police or Building Security will be contacted immediately. The dispatcher on duty will contact Environmental Health and Safety by phone, and EHS shall take the necessary actions to mitigate or remediate the situation. To clean a spill, put on gloves, goggles, mask, and Tyvek or coveralls to protect skin and clothing while cleaning. Use absorbent that is provided in the spill kit and place on top of the spill, allowed to soak for recommended period of time. Use disposable scoop, pan, and brush to collect residues and place in the properly labeled container for disposal. Use a quaternary ammonium cleaner or 10% bleach solution to decontaminate the area and clean any reusable equipment. Place decontamination residue and towels in the container with the spill cleanup. Finally, complete an incident report located on the EHS website. In the event of an exposure, first get immediate care using eye wash, shower, soap, or water, using the incident protocol. Next, get medical attention through urgent care or the emergency room. Next, for reporting, report the incident to your supervisor and complete the incident report. And last, the follow-up, request healthcare professionals' written opinion and comply with additional testing requirements. If you have any questions, contact the EHS department at 3427.